Hey there, it's Dr. Jim. Thanks for stopping by. My topic today is person-centered benchmarks to dignified care. So, dignity is a necessary component of a solid foundation for person-centered care and should be on the forefront of the caregiver's mind in daily routines. Human nature does get in the way, though, every now and then, of delivering dignified care. And caregivers can put their priorities before those of the resident, become annoyed at high maintenance residents, and I'm air quoting that. I don't think they're high maintenance, but or engage in conflict with coworkers. So it's important to step back, take a big picture look at the kind of care being delivered, and make improvements where they're needed. That's where person-centered benchmarks can help. Why be concerned with dignity? The easy answer to this question is because every human being deserves to be treated with respect and dignity. Senior care is becoming a more diversified space filled by people from various backgrounds, races, ethnicities, cultures, religions, gender orientations. Diversity today means something much different than it did 10, 20, 30 years ago. Regardless of one's background, though, human is human, and everyone is entitled to respect. Healthcare professionals are also bound by their professional code of ethics that promote and enforce dignified care. It's a part of their professional code of conduct. Most, if not all, care communities also have policies concerning dignity. Dignified care can have a significant impact on psychological and health outcomes of the resident. In other words, dignified care is good care. We also need positive staff attitudes and behaviors. Great person-centered care begins with person-centered attitudes and behaviors. Residents feel that they matter, they have a voice in how their care is delivered, and they can make meaningful choices. That's all important stuff. Personal identity. Each resident maintains their personal identity and doesn't become just another resident to take care of. Care staff and the environment embrace who they are and appreciate the differences they offer, and the values, beliefs, and all of their relationships are very important things. Now, boundaries are important too in terms of person-centered benchmarks. A very important person-centered dignity benchmark is the recognition and respect for personal boundaries. A resident's space is their own and should not be infringed upon rudely or callously by staff or anyone else. Communication. Dignity is transmitted from one person to the next through behaviors, actions, and speech. Communication is a key ingredient in delivering dignified care and should be geared towards the resident's level of understanding. It should be friendly, lighthearted, non-clinical, and empathetic. Privacy, confidentiality, and modesty are all important. Dignity cannot be delivered without keeping certain matters private and confidential. One of the only reasons resident information should be shared with the care team is to enhance care and services and ultimately quality of life. Care staff should also try their best to maintain modesty in care, which means protecting the resident's physical body from exposure. And we could start with a pleasant greeting. This is a person-centered benchmark. Dignity starts within the caregiver's heart, their soul, and their mind. They have to feel it and transmit it to their residents in order for it to be felt or experienced by anybody else. Basic everyday actions, including greeting the resident by his or her preferred name and title. That's a good start. It opens the dialogue and care experience with respect and recognition. And as the employee treats the resident as a unique individual. Now, here's some care tips. Providing care in a clean and pleasant environment does promote dignity. Offering good food that the resident prefers is also a sign of respect, especially if dietary needs and their culture are taken into account. Okay? Being sensitive to gender and humility during personal and intimate care is necessary when undressing, showering, or other types of personal care are provided. These are sensitive issues that are associated with dignity. Being sensitive to pain and discomfort is also a sign that care staff is in tune with the residents' needs. They slow down and they slow down their care and they ask about pain levels before moving forward. Paying attention to pain is dignified care. See, I'm looking at this quite differently. Sensitively handling issues of bladder and bowel incontinence, and sometimes both, which is called double incontinence, is part of dignified care, for sure, because the resident can easily feel shame and humility. And there's no room for these types of feelings when we are providing real person-centered, dignified care. So, I'm yapping a lot, but I want to end on my final thoughts. Why think about dignity in senior care? And why think about it often? Because it's due to everyone who requires assistance, living their lives under supervised care from a staff that believes in a person-centered philosophy and uses benchmarks like the ones that I've identified in this video to measure themselves. I'm going to end on a question. How do you measure your care team concerning these person-centered dignity benchmarks? Those of positive attitudes and behaviors. Treating residents according to their personal identity, respecting boundaries, communication, privacy, confidentiality, modesty, pleasant greetings and hellos, and providing modesty during care. So, that's all I have for now. I'm Dr. Jim. This was Person-Centered Benchmarks to Dignified Care, and I'll see you soon. Keep coming back for more.